Another important carcinogen is spermatozoid. It also causes the changes, metaplasia. So if it is changes in the that is ectocervix is stratified squamous epithelium, endocervix is so adenocarcinoma. If changes in the columnar epithelium, that is called adenocarcinoma. Okay, so squamous epithelial carcinoma in the that is ectocervix. You see, you know this is some changes the malignant cell that is pap smear. If you do pap smear, we under microscope you see the here the nucleus is enlarged and all cell size is abnormal. This is some slide and appearance of the cervical. You see the, you know the that is what is this nucleus? You know, you identify the cell. What is this? Nucleus. This is cytoplasm. This is cell wall. The nucleocytoplasmic ratio increase. Nucleocytoplasmic ratio increase in malignant cell. You see the 6:1. It is reverse. Okay. Yes. Then, so this pap smear is so important. And the changes here it is started basal 1/3. Then 2/3, then almost all is affected. The stratified, all the layer is affected. You see this is acetohyte change. This is cervix, and after applying acetic acid, it becomes white, dense white. Sometimes faint white, sometimes dense white. Okay. So it is acetohyte positive, and after that, what we need to do confirm. How we can confirm? By the biopsy, by taking tissue biopsy. Okay. So you see easily we can diagnose easily by earlier screening. Mosaic pattern, mosaic. This is mosaic pattern. Floor in the floor. If there is mosaic. This is the abnormal. It is the findings of colposcope. You already the term colposcope. So by the colposcope, the mosaic pattern of the abnormal epithelium. I told you cervical intraepithelial neoplasias. There is some management here. What we need to destroy these changes. How? How can we destroy? By applying some heat coagulation, by applying some frozen ice like some things, or we can cut down. So these are the methods: cryosurgery and laser ablation. So we can, if we by screening, if we diagnose earlier, we can manage also. Okay. Then others are loops, electrosurgical excision. You can remove this LEEP. Cold knife conization. This is also one of the method by electricity. Laser cone excision. Okay, and ultimately, if there is we feel the patient is very high risk, then we can also do the hysterectomy. Especially the perimenopausal women. Okay, so these are the management of the CIN3. Also CIN2. You see, this is the machine, a cryosurgery machine. This is a probe, and we connect with the nitrous oxide. Nitrous oxide gas, and we apply for 2 to 3 minutes. Gas is passed, and then it makes at the tip of this machine in the cervix makes a ball of ice, and it causes frozen of the tissue, and frozen tissue become dead by this. This is a loop. This is for cut down. You see, there is wire like we can cut the structure. So health education. What are the health education? Avoid sex in early age. Avoid multiple sexual partner. Use condom. Improvement of personal hygiene, don't smoke, improvement of socioeconomic condition. These are your health education. Okay. Then all of you know the vaccine. What are the vaccine available in our country? Cervix, the vaccine against the virus. Cervix, that is, and Gardasil. That is, the Cervix is what is bivalent. That is two virus, only two strain, and pentavalent. There is pentavalent is Gardasil. In our country, that is Cervix is available against two virus strain. So you cannot prevent it 100%, and only it may be 75 to 80% we can prevent it. And the doses in the item, it is also dose 0, 1 and 6, 3 doses. Okay, it is to be more effective. Like should be given a person start having at the very early age. It should be started. So vaccine is also prevention, health education, screening and vaccine. So screening program should be effective by this alert. So you see the cytology, you should read cytology, pap smear, via test, already I told, like this is with leukocytin, SPB DNA test and colposcopy. So pap smear, there is sensitivity and there is specificity. Sensitivity, you know what is sensitivity? Sensitivity is positive when it is really present. Specificity, it is absent when really absent. So sensitivity is 85%. That is cytobrush. Sometimes we use this, the cytobrush. This is air spatula. I took from in our Din hospital by this air spatula, pap smear. By surrounding this surface, we try to collect the cell from the surface. Okay, and then we make the smear. We put in the 95% alcohol to fix the cell, and then we dry it and then send to the lab for cytological examination. So you see the via sensitivity 82, 88%, specificity is 78 to 86%. And sometimes we clean this like in this way. The via is very safe and simple procedure. You should ask. Colposcopy also we do, and SPB. This is the colposcope machine. Okay, it is like microscope. High magnification, we see the cell in the surface. You can see the vaginal wall, we can see the vulval wall, we can see the cervix. So this is European cervix. You see there, so we can take, this is by the acetic acid test, acetohyte. Then, so when we do the, sometimes you read in question, when you do the colposcopic examination. So when we found the via is positive, CIN test, we can suspect CIN, and cervix is suspicious looking, and infection with the human papilloma virus. Okay? Use the biopsy technique. This is the punch biopsy process. Punch biopsy process. Just we cut some tissue. It is anesthesia needed or no need. Cervix is very insensitive organ, not so sensitive and not so painful. So easily we can do by this punch without any anesthesia. No pain. So like biopsy, then. So conclusion, prevention by vaccination against is now popular, screening and colposcope. Okay? Anyone, you need to ask anything? You know, this is the monogram. Anyway, you need to read in the colposcope. You need to know about something also about colposcope. Okay? So what I show today, screening of the carcinoma cervix on scenery of the carcinoma cervix with management and Diagnosis of the CIN and management of the CIN, okay? Anyone? Anything you can ask. So, screening is so important. So, I show you just now the carcinoma cervix. What are the other malignancy? Breast carcinoma. So, what are the screening method for the breast carcinoma? Every month after menstruation, self-examination of the breast and clinical examination of the breast, and mammogram, ultrasonogram is important. So awareness is so important. We can easily diagnose. And then ovarian carcinoma, it is so difficult sometimes. Ovary is the inner organ, we cannot see, so difficult. And most of the patient comes when? Late advanced stage, when it is spread more, then most of the patient comes to us. So to prevent ovarian carcinoma, difficult. So that is some parameters are fixed. Annually, every woman should check her cervix, uterus and female genitalia by manual examination, speculum examination, and TBS, transvaginal ultrasonogram with Doppler study and tumor marker. If you suspect, then tumor marker. So every year by manual examination, transvaginal ultrasonogram with Doppler study and tumor marker also, okay? And what is another is endometrial carcinoma. Endometrial carcinoma is also common nowadays. Lifespan is more now, and there is so many factors, nulliparous, sometimes there is so many histories for the obesity, diabetes mellitus, hypertension. There is triad, there is obesity, hypertension, diabetes mellitus, all are risk factors for the endometrial carcinoma. So what are the screening method? Screening method from, that is endometrial cavity inner side. So something fluid or cell should be collected from the uterine cavity. How can we collect from the uterine cavity? By aspiration, by taking aspiration the fluid from the uterine cavity. By how can we aspirate? MBA. There is some MBA syringe. MBA syringe we can aspirate, or there is also a special device. Syringe, long small cannula like. By connecting syringe, we can collect also aspiration syringe, and also by the fractional curettage. Sometimes fractional curettage. Uterus has 5 walls: there is anterior, posterior, 2 lateral, and fundus. So from this wall, if we suspect, we can curate the tissue and we can do the histopathological study. Any other, that is fallopian tube, very problem, only by laparoscopic guidance like this. So, and vulva and vagina, any screening method for the vulva and vagina? Screening, yes, like this, that is via. If we suspect, you can put the acetic acid. If any change or any suspect, any ulcer or any abnormalities we suspect, we can take biopsy. Biopsy from the vulval tissue, abnormal detected tissue, we can take the biopsy. Vagina also like this, by colposcopic guidance biopsy. By colposcopic guidance biopsy. When we suspect, we put acetic acid and we see by the colposcope and take the biopsy and send for histopathological study. So overall about the carcinoma malignancy, that is malignancy of the female genital tract, screening, and only I show the carcinoma cervix on scenario and management. Okay. Any other things for today? For today enough. Okay, thank you. Roll call you.